Assalamu alaikum. Welcome everyone on board. Uh, Sorry. So, actually, the purpose of this session is just to have a look at like what are our concept about studies, and actually when we are appearing in the exam, what are the things which are being expected, and actually beyond exams, when we are in the practical conduct of anesthesia, what are we looking for and what should we know? Okay, because this is unfortunately a confusion that not all residents get a fair chance of being exposed to learning because of a lot of other peer pressure, family problems, work environment issues, and not getting the concept how to, because when we do schools and then go to college and then go to medical college even, and after that even when we are appearing for the final exams of MBBS and everything, we are only studying one subject. Okay, and then we are not able to integrate the whole number of subjects together. Okay, that's the first time when we are appearing in FCPS part 1, for example, or any basic science exam which is for post graduation. Now the problem occurs because now we have to correlate, because any question which will be coming, it's least likely that it will be only from the knowledge based on anatomy, or only from knowledge based on physiology, or things like that. That question which will be coming will be based on the knowledge. You, not all questions, but usually they will be needing critical thinking and integration. Okay, so unfortunately when we are not able this integration, so then the problem starts. Okay, so that's the problem, that throughout the training, unfortunately, when we start our anesthesia residency day one, a majority of people just get the advice that read Morgan, or they say that read the first 17 chapters or first 18 chapters of Atkin Head and first 13 chapters of Morgan. The problem starts from there. The issue is that the book which we people, majority people are worshipping, this Morgan, unfortunately they don't know that this is not a textbook. And maybe if you ask me, maybe my statement will not be appreciated by majority people, but the thing is that there is no proper textbook of anesthesia, because it's not possible to write a textbook of anesthesia, but because maybe it will be so big, or it should be so comprehensive or extensive, because it's not limited to one subject. If we, for example, if we are studying thyroid, we should be knowing about the surface anatomy of thyroid, we should be knowing about the anatomical lobes, and then the structure, blood supply, nerve supply, how it is functioning, how it is being controlled by other subject, what is the role of hypothalamus, what is the role of pituitary, and then the next step will be that what are the signs and symptoms of hypothyroidism, how it is controlled, and then next step, what is the clinical correlation, and then what is the anesthetic role, and how to evaluate the patient, how to prepare the patient, and then the complications, the thyroid crisis, the mixed edema coma, radiological evaluation, thyroid scan, and things like that. Okay, and then the post-operative complications, which are also when we are dealing a case of thyroid, actually we are also dealing with parathyroid. So actually, when you are starting as a newcomer, you should be studying this topic in that way. Just tell me any. This is an open question to all of you. Is there any book which will cover thyroid in that way? Any comments, please? The way I just told you. And Nimra, because now you have to take the lead, you have passed the exam. So I want to listen from you. Or anyone who has just recently passed. Nimra, I would like to listen from you. Where are you?
अस्सलाम वालेकुम आई होप एवरीवन इज फाइन सर बस यही ट्रिक है कि
No,
आपने
just a
ना
second. First of all, there are some people from maybe from other countries, so just try to speak in English. Okay.
okay the only trick which every one of you needs to understand is just to follow the things which we do on everyday basis with every single case, every single patient. What are our habits? What we learn in OT, that matters a lot more than cramming the books. Although
And another,
we should have
just
sufficient
just
knowledge.
Nimra, just with relation to just the opinion which I gave to you, I gave to the house, that the thyroid, I give the example, the thyroid, you should be starting from the anatomy and finishing on the clinical aspects. Do you think in any book
Exactly.
you will find this thing?
No, no,
No.
we
Okay.
cannot
So the
get everything inside one book, or by
yes. So till the
combining more
time,
than 10 books.
yes. So unfortunately, we will have to look, we are bound to have a look to cover one topic of thyroid. We should be learning it from around 4 or 5 books. Otherwise, in the exam, even in MCQs, even in oral part, you will be in trouble. Okay. So they hypothetically there should be a book which is covering everything from anatomy up to radiology up to management. And unfortunately, because anesthesia is a recently developed specialty in last maybe 70 years or 50 years, a specialty has been it's still emerging. So there are so many aspects which are still not properly documented in the books. So now what is the solution? The solution is only that you come out of this myth that I will be holding a 5 page paper and it will give me all the coverage of all the topics, and I will pass the exam and I will be able to conduct anesthesia. Am I right, Nimra?
Yes, you're
Anyone
right, sir.
So that is the problem. So now since you have passed the exam, now you can just look back and just imagine that the day one of your residency, you were asked to read Morgan. Just tell me one thing. Now, after 5 years, would you like to
Sir,
just
I
pass?
didn't read Morgan, to be honest.
Okay,
I didn't read even Morgan in my party.
maybe that's why you
Didn't done
passed.
that.
Sir,
That
I
is the
read
reason.
Morgan thoroughly and I passed too. Sorry to say, but it's just a thing, you have to cover your topics from anywhere you feel it's sufficient. Matlab, I also read consulting, I also read articles on the topic. It's not about the Morgan. Yes, Morgan is a dated book. I admit that it contained
Ye-
things which were
yes,
useful ages ago. I think
I
it is
would
a good
just comment on.
pathophysiology, but it
Yes,
don't contain intra, post, and pre-op management of the patient very well. But
yes,
it don't cover those parts.
yes, doctor.
It have the pathophysiologies are excellent in that book, but the other part.
Yes, actually, that's what my plea. I'm not saying that any book is bad or any book is good. The problem is that my again, I rephrase my question. Is it possible to pass the exam only by reading Morgan? Yes, Dr. G, I
No,
just want to listen.
no, no,
Not
no,
at all.
not at all, not at
That's not
all.
all.
You have
That's yes, that's
in
Sir
what actually.
Morgan's
exam
sir,
oriented.
sir Morgan's covers only and only definition and pathophysiology. That's the first part of exam. Second
Yes.
part of exam from like how you will give anesthesia, what are your concerns? It is not from the Morgan, sir.
No,
Not
and
at all.
another problem, what's another problem? The problem is that it is written maybe in some other part. It's not written in the compact form. Okay. So the problem is that
Yes,
if you are,
exactly.
Yes, sir. Same I want to say it is in Morgan it is written haphazardly, sir. If you want to cover first you will, for example, in diabetes, for example, in COPD, you have to do for pulmonary function test. You have to go for CPAT. It is not written in the topic. It is written somewhere else, sir. You have to also cover that also.
yes.
In
So that's
exam, they
why.
are asking this.
So that's my message to all of you. That's the purpose for me to have this session, is that if you want to have a good concept of anesthesia, please come out of worshipping a single book. It may be any book, maybe any book, and try to chalk out what are the say requirements of a specific topic that you should be covering, because at the end of the day, even when you pass the exam, I tell you something, now the responsibility will be appearing on you. So the Dr. G and Dr. Nimra who have passed the exam, believe me, now you will feel the pressure, because you will be in aura of this exam now, and you should enjoy, because this is the best time of your life. And after that, whatever exam you are appearing is nothing. It is just without any pressure, because this is the last exam you did with some pressure. And you will not feel this thing after ever in your life, I guarantee you. But now the problem will be that now you will be on the other side of the table, and now people will be around you, and now they will be asking, Dr. Nimra, we are bringing this patient. What should I do? Your resident will be around you, and now you have to take the decision. Okay. So now you have to apply whatever you read in your life. And now you will realize how much important it is to have a decision making from the first year of residency. That if you are able to do the decision making, of course, anesthesia is so crude that anyone who knows is to give spinal, anyone who knows to do endotracheal intubation, everyone, even technicians know that we have to open sevoflurane, we have to give muscle relaxant, we have to give bupivacaine, we have to, when the blood pressure is going down, we have to give epinephrine or ephedrine or phenylephrine. But how to use it perfectly, this is this is difference between a technician and a doctor. Okay. So now you have to understand this thing. So now some words for the people who are in their training and who are trying to understand how to appear in the exam. Please, my request is, because back in Pakistan now the system has emerged from a very compact one having MCQs, SAQs. Now it has changed to a terrible system of only MCQs, which I'm using the word terrible. I am again and again and again trying to contact the people who are decision makers to have a look on it. But unfortunately, I am not getting any support from the residents. So you should all, wherever you are, my message is, I know that maybe it looks very easy that you have a terrible pool of MCQs recall and you are reading them and passing IMM. Okay. But again, I tell you, again, maybe you second step, again, you will pass. That you have out of 200 MCQs, you are able to recall 150 MCQs from the pool of terrible half cut MCQs, and you are preparing them, and you are even passing the written exam. Now Viva will come. And even I can say that even if, for example, you are very smart, you pass the MCQ Viva as well. Now when you are in the real time practice, if you are tackling any situation, if you don't have the clear concept, believe me, you will suffer. And if you imagine that you are dealing with a patient who is someone's mother, brother, sister, father, any dearest one, would you like, just imagine, just for instance, be a little emotional and just think that would you like your mother or your father to be anesthetized by a person who did not have study the topic in a proper way and have does not have good concept, passed exam through Aisha Beg or a pool of terrible MCQs pattern, and now they are anesthetizing your mother or my mother? Would you just ask this question, all of you? This is a question to all of you. Would you like to have your mother anesthetized by such anesthetist? I am 100% sure everyone will say no. Okay. So now, for example, if you don't want your family members to be anesthetized by such a person, I think you should not offer someone else, mother or father, to be anesthetized by a such person. So this is something very serious. Believe me that anesthesia is one of the specialty which is different from any other specialty, because the domain of any other specialty is very limited, and they are doing something very, very limited. Anesthetist is just like care of anesthetist is given by the care which is given by anesthetist is just like care given by the mother. And believe me, mother is cautious about everything. Maybe father, I am a father, so I can imagine that maybe I will ignore a number of things. Not that I don't care or love my kids, but my care will be different. My care will be crude. I will be dependent. I know that there is a person who is very meticulous and taking care. That's what the care of anesthetist, difference between the care of anesthetist and the surgeon, because they don't bother. You just imagine we will be telling, sir, there is a serious arrhythmias going on. They said, should I continue or I don't continue? Or they are not bothered. They are just thinking that this responsibility is on the anesthetist. So, and you have to take care even from the positioning to the IV lines, to the position of the neck, to the position of IV line, position of joints, everything. Because at the end of the day, that if you don't cover the eyes properly and there is a scratch on the eye or a scratch on the face or anything, it is your responsibility. So anesthetist has to look into the things in multi-dimensional way. So that's what my message is. So you will have to study like that. So now how to study it? There are different ways. Some people will say that basic sciences you have to study first, but I will suggest you that, for example, if you are studying a basic sciences subject, correlate it with clinical, because it's least likely that this basic sciences you are studying will be used alone. Okay, and this message now I'm trying to keep all of you attentive, so that like the people who have passed the exam maybe don't not interested in listening these things, but the people who are now passed the exam like FCPS now you have done, you should be thinking to appear in Irish fellowship exam, FCAI, which is nearer to FCPS, and it was very easy to appear in that exam. And now if you ask me what is the difference between FCPS and FCI, the only difference is that they are asking the questions or following the protocols. Okay, their questions will be on the basis of guidelines. Like for example, AAGBI guidelines. I will just try to share the screen as well, but there are some things. Just a second. Okay, so there are some societies like AAGBI. Okay, anesthesia tutorial of the week. A number of people now you are when I was doing my exam, I didn't have access to anything, but now you people have British Journal of Anesthesia Education, BJ Education. Okay, and this there is one anesthesia and critical care Elsevier, something like that. Okay. So these articles I have arranged also AAGBI. I have arranged in the articles folder so you can access. And now their question will be like, for example, I give you example that they are asking you about maternal mortality rate, or for example, they are asking a question that what is the major cause of maternal mortality. So they are relying on this CMAC, so this is confidential inquiry in maternal and child health. So their question, the data which is published latest by them, they are because maybe it is PIH, maybe it is maternal hemorrhage. Okay, so maybe this is the number one or this is the number one. So you will have to find the answer according to that. So it's not difficult. You can easily tune yourself topic oriented. So this is the exam, for example. But now my message is that the people who are studying now, if you people are studying in that way, you will have no problem. Like the day you pass your FCPS exam, immediately you can appear in Irish fellowship exam, FCAI. Okay, because you are tuned yourself like that. Similarly, if you are preparing the things in an order, you will have no problem. Another message for the people who are doing even MCPS or FCPS, I will suggest you that the one of the way of studying, which is now people not aware of, because now things are different for you. Just a second, please. Okay, so that is now up. Now you are not following is SAQs. Okay, even for the people who are studying now for MCPS or FCPS, I will humbly request you to have a look on these books. You will find small tasks. Yes, of course, you are saying this is not our pattern, but still, I will suggest you to have a look on these books. Like, for example, you can just read the question and let me show you. Okay. Like, for example, forget about the answer, just read the question. What characteristic neurological changes occur immediately and first 10 months following spinal cord transaction? Okay. So this will be just a practice for you. Maybe this question will not be asked to write down, but if you have practiced yourself in a way that, for example, now you have read neurosurgery. Now you want to see whether you know about it or not. Open the chapter of this book or read. So just try to have this answer like that, and then whatever you know, and then you compare it with the answer. Okay. So you will find very good knowledge, which will be methodical and it will be task oriented. Okay. So this I'm giving you an example of how to utilize these sources. So These are 1, 2, 3, 4. And then another question now it will come that, sir, should I have to read all the books? So, and actually the thing is that you don't need to read all of the books, number one. And number two, you don't read, there will be a lot of repetition, that maybe the questions which you are reading here, the same questions will come here. Same questions will come here, the same question. So you don't need to read each and every line of the book. You just have to look at the source, look at the question. What are they asking? And then maybe you already know it, you don't need to read it, or anything which you find, any chart or any point which you find it good, take it out, note it down in your paper, and paste it in your holy book of Morgan. Okay, because I know that whatever I say, you will be reading that book. So you can take it out, pluck it out, what is the thing which you did not find there. Just make, or you can make a copy with the points written in there, so you don't need to read it again. You don't need to read it again. If you just have look at it, you know the questions, what are the questions are written. So my suggestion will be, one by one, you should be doing all these books. Okay, this is a new pattern which I am requesting my senior CPSP fellows to convert, because this is the future. This is CRQs. This is called as constructive review response questions, and these are very small bit of things. You don't need to write a lot, and they are very methodical. This will be, what will be the next step, and you just have to write, they have done this problem, they have done this, they have done this, and now what will be the next step. So questions like this. So I will again suggest and request you to have a look on these books one by one, and you can do it. You don't need to print out each of them. You just have a look one by one. You just note down the important things which you did not read before, and put it in your book. Okay, so this is the books which you don't see at all. Another important component is these basics review book and clinical anesthesia review books. Okay, and this MCQs world. In this folder, there are a number of books. And again, people ask me that we have to read all the books. So I tell you something, that you open one book and try to answer the questions. And maybe out of 100 questions, you are able to answer, for example, uh, 20 questions or 30 questions. You have some knowledge, and now you are going to the next book, and you are finding maybe now 10 questions have increased. And gradually, when you open a new book and you are able to answer 100 out of sorry 80 out of 100 or 90 out of 100, you say now you are prepared. And you will see that you will find a lot of repetitions. The unfortunately problem is that people are only looking for the books, sir, from where MCQs will come. This is disaster. This is the biggest, the day you will come out of this misery, only then you can say that you prepare the subject. If you open a new book and still you are not able to answer the questions or find the answers, it means your preparation is still not finished. That is the basic theory. So I have arranged books. Maybe new books are already published, but you will find this is for basic sciences, this is for clinical sciences, this is for regional anesthesia MCQs, this is for the people who are appearing in the prometric exam for Gulf countries, UAE, Saudi Arabia. This is MCQs. These are some books for ICU MCQs. And then if you go to any of the folder, you will find a list of books, and actually they are similar. Maybe this book is good, maybe this book is book, maybe this book, a number of books now you already have. So you can choose one by one, and you will find the concept. So again, I say that if you open a new book and you are able to answer the questions, it means that you know the subject. And when you are reading clinical sciences books, an important message is that the management changes. Maybe value will be changing. Don't try to spoil your concept by a single MCQ of a single book. This is all practice books. If you have any doubt or anything which you read and it is different from the concept which you had, try to verify it. Try to verify it from the source. The source will be either your book or articles or internet. You can confirm that I had this concept, and now I am finding this thing which is different from the thing which you already have the concept. So try to verify it. Okay. So this is for, actually this a number of books have choose the best, but a number of books have true false. Like for example, this is Cubase 5, and it includes clinical sciences MCQs true false. Okay. but you will find a lot of knowledge. Believe me, if you read them, maybe you will say, sir, our pattern is not this. No, try to extract the knowledge, because it is wonderful to read true false. You will find the real knowledge in true false. Believe me. Choose the best. Yes, of course, you have to choose the best. But if you want to expand your knowledge, which will help you ultimately in finding the answer and choose the best, uh, I will highly suggest you to read these books, because you will find maybe you will read this MCQ and you will only learn 5 points, 5 or 6 points. So that will be increased to your knowledge. And when MCQ will come, it will be um, like it will help you in finding the answer. Actually, in best choice, these are the books for our exam pattern. There are some same uh, uh, this is the fifth edition, this is the sixth edition. Okay, so a number of editions are repeated. Okay, and just a second. Okay, so so these are the source of books. This is for regional anesthesia. This I have put a number of books here. Similarly, review books. These are excellent books, and you can just have a look on one topic, and again this will be a practice for you, that this will be real time. This book and this book are excellent. All others are similar, but at least these one or two books I will suggest you to read. This is some similarly review books for ICU, and some other. This is also for oral part, but actually the concept should be that when the day when you are appearing in written exam, the day if you have the knowledge which will pass your oral exam. I repeat my words. The day you are appearing in written part, the same day, if you have the knowledge that after written exam, you are having a viva and you are able to pass the viva, I guarantee you that day you will not fail in written. But if you are appearing in the written with the way that if someone is asking you something and you don't know, you are not able to explain the point or that fact to him or her, you are still lacking in your preparation. So there is no guarantee. Maybe you pass, but there is no guarantee. So try to study in a way that the day you are appearing in the written exam, that should be the day when you are able to pass the Viva as well. Unfortunately, we just dissect and we just divide the things in a way that we are not able to find out our way. We are trying to say, let us pass written, sir. Then we will think about Viva. And that is a terrible thing. There is no guarantee for you that if you have such concept in your mind that you will pass the exam. I guarantee you. I can guarantee you this thing. And whosoever is telling you that first of all think about MCQs and first of all then think about Viva, there is sometimes only 1 week, sometimes 10 days, and you are not able to grab in that small period of time. Okay. So my suggestion for anyone, this is not only for our exam, any part of the world, people are appearing in European diploma in anesthesia a lot. Okay, people are appearing in FCI again from other part of the world, because maybe this words are being listened by the people who are not from Pakistan, from other part of the world. My request is the same. Try to understand the topic rather than understand the book. You are not there to to do the publicity of a specific book. In the real time, you should be knowing the subject. Only the question will be asked and you have to answer that question. There is no guarantee that a one specific book will give you a certainty. So when you are reading about any specific topic, just try to know, try to gather which are the things which you should be knowing about that topic. Then it will become very easy. Okay. So that's what I have tried to do in this folder, this topic wise question, because unfortunately I am not able to do all of them. Okay. But a number of topics I have defined, I have tried to put down the things, to pearls, which you should be knowing. So you can have a look. Now, because before I used to don't used to take these Zoom classes, so my concentration used to be here. I was able to find make some more questions, more and more questions. But unfortunately, since many months, I am not able to do. This is, I will highly suggest you to have a look. For example, this is anesthesia planning, and just a second. Yes, yes. So this is a file which I will suggest you to read. Like for example, if you are reading a specific disease, you name any disease. For example, myasthenia gravis. So what is the main category of that disease? It's a neuromuscular disease. Okay, it is a neuromuscular weakness because of post synaptic problem. So acetylcholine is released presynaptically, but there is no receptor or less receptors to make the excitation contraction coupling, and there is muscle weakness. Okay, so this is the main category. Pathology also I have told you. Mechanism of the problems. So now the problems will be, it will be anywhere in the world, anywhere in the body. All the skeletal muscles will be involved. Okay. So, but for us, for anesthetist, the muscles which are important are bulbar muscles and respiratory muscles. We are actually, yes, eye muscles, you will say that ophthalmic is very important for a physician, not for anesthetist. For anesthetist, yes, you will only see the severity, and you will say that, for example, if ophthalmic involvement is too much, maybe other involvement, but still there is no guarantee that if ophthalmic muscles are good, the other muscles may not be involved. So for us, two things are important: bulbar weakness, aspiration risk, too much secretions, this thing, and respiratory muscle weakness. Okay. So the other aspects will be that myasthenia gravis is diagnosis of the disease and evaluation of system involved and estimating the severity of the disease. I'm trying to answer these points through this point that diagnosis usually it's not for us. They are doing tensilon test and they are doing ice pack test and they are doing some other test. But for us, more important is history of uh, regurg and obstruction during sleeping because of the bulbar weakness and the obstruction of the airway it can cause, it can happen, and respiratory muscle weakness, which we will be doing by pulmonary function test. Okay, so that is more important for us. For us, tensilon test is not that much important because it is, yes, it is done for diagnosis, but for us that's not much very important. Then other thing will be the medications the patient is taking, because there will be involvement of autoimmune disease. So there is some other autoimmune disease which can occur. So the patient may be taking steroids, patient may be taking immunosuppressants, or there will be presentations of other autoimmune disease, like maybe rheumatoid arthritis, maybe any other pheochromocytoma, like any other, sorry, if not pheochromocytoma, any other men's, it is also, I think association, if I'm not wrong, it is also associated in the some of the type of men's. Okay, maybe I'm wrong. Just pardon me if I'm telling you something wrong. But it is also involved with any other autoimmune disease. So that will be one of your consideration when you are dealing with myasthenia gravis. Okay. So you will be able to chalk out that this patient will be taking medications which have cholinergic symptoms, which will have problem with the aspiration, problem with the airway, problem with the post-operative ventilation. So this is one example. Okay. So at the end, how much you can optimize for every patient, you will be looking like, you will be at the end of the day, after having a look on these things, you will be seeing history, examination, investigation, evaluation. Okay. And then risk assessment and stratification. What you can do, what risk you can see, that what is the risk, like if the patient with reference to myasthenia gravis, if the patient is taking too much dose of steroids or anticholinesterase, it means this is severe disease. If the duration is too much, it means this is a severe disease. There will be chance there is some problem with the pulmonary function test, vital capacity is decreased, it is a risk factor. Okay. So things like that. So take this word, have a printout, and try to put these words in or any disease you are reading, rather than cramming the page of any holy book. Try to have this frame and try to find the answers in every disease, and in every patient you should be looking how much optimization you can do, and how can you have some reversal of the problems which you have, and estimating the cardiac risk, pulmonary risk, renal risk, aspiration risk, UNV risk, airway management risk, special monitoring needed. Any patient, any case, any topic, any disease, maybe you will be looking for any specific monitoring, like with reference to myasthenia gravis, maybe you need to know to monitor neuromuscular blocking, neuromuscular monitoring more than any other patient. Okay, because maybe you don't need to give any muscle relaxant at all after intubating dose of, for example, whatever way you adapt for intubation. Maybe you don't need to give any muscle relaxant following it. This is one of the example of special monitoring. other than standard 2 1 and standard 2 monitoring. So any patient, any disease you are dealing, just try to have a look at it. Okay. Similarly, blood transfusion, fluid, what fluid you are using, what position you are doing the surgery, doing the surgery. Okay. I have put it actually in the surgical aspect, but actually the thing is that whenever you are reading any disease, try to put this, try it. And what people say, that if you don't feel any benefit, contact me. I can guarantee you that if you start reading any disease in that way, you will be in different world. Okay? And then try to put your whatever knowledge you have got and try to find the answer. Maybe in some diseases everything will be there, and maybe in some diseases only one system will be involved. There will be nothing to be done. But if you make, you can modify this piece of paper, because I write it myself with my thinking. I did not take it from any book. This is all my thinking, which I have reproduced. So there may be some mistake. There may be some improvement. If I, rather, I will be very, 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 very happy if you have a look on this paper, and if you want to correct it, you want to add something. It will be a big blessing for all who will be benefited by this thing. Okay. So this is my request, that now disease, and now you think like with reference to this pre-medication monitoring induction agent, like we can just put it out here. We need to give some acid prophylaxis. So this will be the pre-medication. We have to give enzylysis, but we have to be cautious, because whenever there is risk of aspiration, you have to give the enzylysis with care. Monitoring, I told you. Induction agent, yes, maybe this patient have adequate muscle relaxation, even intubating condition, only with inhalational agents or only with muscle induction agent. You don't need to give any muscle relaxant. So this is one consideration. Similarly, muscle relaxant, there will be resistance to succinylcholine, and extra doses will be required, and there will be chances of patient going into the phase 2 block. And there is too much sensitivity to non-depolarizing. So maybe you are using only 1/10 dose of muscle relaxant. And in that way, cisatracurium will be a better choice, because it will be metabolized in the blood and there is no metabolism needed. And maybe this is a short acting, you can use it. Okay. Similarly, you can have a plan for maintenance, analgesia, fluid therapy, recovery, and post-op course. Maybe any patient who always need post-op monitoring in HDU, like myasthenia gravis, will be one of the cases, because you are never sure after the surgery patient does not have a very good respiratory function, and there is some atelectasis, there are chances of hypoxia, hypercarbia, chances of pulmonary complications. So you will not send this patient in the ward and thank you very much. You will keep the patient in the HDU and you will monitor it. So again, I am putting emphasis. Please, please, please don't embarrass yourself. Don't embarrass yourself. You are not ordinary people. Not ordinary people reach up to this level of doing post graduation. Don't, this is your insult, that if you are just trying to have a shortcut by of some bloody notes on some bloody MCQs pool, this is your insult. I don't want any of my fellow to be insulted in that way. Try to study in that way. Try to have, I guarantee you that if you read 20 diseases like that, you will be in a different planet than where are you at the moment. Okay. And you can do it. I have full trust on all of you, whosoever is listening my words. Okay. So this is okay. So similarly, whatever patient you have, there will be some demographic like age, sex, location, occupation, and personal habits and personal history of surgery and medicine or anything. This will be person, this one, and there will be specific disease which the patient will have. Okay. So one of that thing will be that thing, and then the surgery related. So I'm just trying to to finish my discussion in next few minutes. So the thing is that you have to, with reference to surgery, you have to see the surgical urgency. Any surgery, think out whether it is urgent. Like urgent and emergent are synonyms, but actually there is difference. So emergency surgeries like fetal bradycardia, for example, this is emergency. Fetal distress is emergency surgery. A firearm having bleeding, this is an emergency. You cannot delay it. You can say it should be done within minutes. The urgent surgery should be done within hours. But usually, whenever you are using emergent, it may be urgent, it may be emergent. So, but there is a little bit difference. Like appendectomy is urgent, it's not emergent. Okay, but a gangrenous foot or a gangrenous bowel is emergent. If you delay even in minutes, the lactate level will be getting high, and maybe you will have a very terrible sepsis or ischemia, or may you lose the limb. Okay, so this is example between the difference between emergent surgery and urgent surgery. So similarly, there is a little bit difference between elective surgery and planned surgery. Okay, so like we always write cholecystectomy as elective surgery, but real sense it is a planned surgery. You cannot delay it forever, because if there are gallstones, it can migrate to the biliary tree and it can cause serious problems. It will cause jaundice. It can cause then at that time it will become an emergent surgery, okay, or urgent surgery. So this is a little bit differentiation, but this is just for your understanding. In examining in books, actually elective and planned are written together, and emergent and urgent are written together. Elective surgery is joint replacements. Elective surgery is cosmetic surgeries. These are pure liposuction. These are the things which are purely elective surgery. But other, usually they are not elective, 100% elective. Like for example, prostatic surgery, it is always written as elective, but actually it is planned surgery, because if you leave it like that, it will cause obstruction and it can cause nephropathy, the obstructive uropathy. Okay, it will create hydronephrosis. So ultimately, maybe the kidneys are gone just because you delay the surgery. So there is a difference. So these are all planned surgeries. But again, I repeat. So similarly, position required. A surgery which is done in supine position is much easier than a surgery being done in prone position, because you need to flip the patient. There can be any injury that time. There will be hemodynamics sequelae. There will be like so many problems. Similarly, lithotomy position or lateral position, there are so many things. So whenever they are asking you any question, you have to think that the problem in that patient, the surgery which is being done, will require head down position or head up position, or this position will have a chance of embolism, or this patient, this surgery is this position. Sorry. So there will be some other things. So only by thinking about the position, you will get a lot of information. Duration, if it is a long surgery, you will have some problems. Okay. So similarly, you like again this and put it on any surgery, you will find a lot of information. And if you make a paper, maybe you can do it in a log style, that you keep a printout paper with you and every patient you fill it. After that, I challenge you, you do it for a few months and then let me know what is the result. After some time, your mind and your eyes and your hands and your foot and your tongue will be coordinated. After some time, you will only listen myasthenia gravis, and this chart will be in front of you, and you will come to know that these things are there for this surgery. Okay, so this is my suggestion to you. That is how you should study. Please, I am again requesting you. You can do it. If a person like me is able to have this status of speaking in front of you, and you people are listening to me, anyone can do anything. I whenever I feel I saw any first year resident, or whenever I feel or see any person who fail in the exam, I imagine myself when I was there. I struggled a lot during my FCPS exam. Okay, so I passed in third attempt. It was last attempt of my viva, and I can imagine the tension which I had, and nobody told me like these things. That is why in on my weekend, I'm giving you my personal time. This is not, I'm not showing or saying something, because majority people don't know me. Majority of people, I never, maybe in life we will not meet, but still I'm doing it because that's the thing which I suffered, and I don't want anyone else to suffer. But for that, you have to commit to cooperate with me. If you will always be so arrogant, so careless, not attending any of my discussions, and I'm just speaking to the wall, nothing will happen. Okay? Because I'm not doing it for any personal fame. I'm not doing it for any monetary benefit. My YouTube channel is not monetized, by the way. You just have a look. There was some problem here, and I am happy that I am not able to do it. Because before I had just think that if I get something out of this channel, I will utilize it for some betterment, like buying some ultrasound machine or getting the subscription. I have these. I'm just telling you so what I'm doing. These subscriptions, I am using one of my friend for this subscription this time. But before I had my own subscription. And this subscription for each year, maybe it is costing 1,000 real, or maybe $300. So even some are even more than expensive than that. Okay, so I'm doing it not for again. I'm not telling you that you become impressed, or I want to impress you. I don't want anything. Okay, so I think that's enough for a while. And any questions you want to ask me, you all are welcome. Okay, and all of you can communicate with me anytime. This is what I wanted to say, and that is how you should be studying. There will be so many things, because it will not be possible to tell everything in this small session. But like this link is there for everyone. This mind maps are very good. These are created by FRCA. They are very good. This not all topics are covered here, but a number of topics they have made some you can say notes, and you should be knowing mind maps for every topic for yourself if you want to learn. Okay, so thank you very much. We will have another session for humidification. I will try it. Maybe we will take it at 7:30 today, because that was something because some people fail in the exam. I just wanted to console them, and some people pass the exam. So I just want to have a discussion from them. So all of you, thank you very much. Inshallah, we will meet again. Bye bye.